Hi, everyone. Welcome to NurseDeck podcast. I'm your host, Jamie Smith, and today we will be interviewing Elyse Shelger. Hi there, Elyse.
Hi, Jamie. Thank you so much for having me on the show.
Yes, ma'am. We're excited to interview you. So tell us here on NurseDeck podcast, what drew you into nursing?
Well, that's a great question. Nursing was actually my second degree. So if I take us back to first degree, undergraduate, I was playing soccer at a top program, Division I, very demanding. And at that time in my life, it was also my number one passion and my main focus. My goal at the time was to play professional soccer. So I chose not to major in any sciences at that time because I wanted to do very well in those classes, and soccer was very all-consuming. So I did end up playing professional soccer in Norway for 2 years. And when I retired from my soccer career, I decided to then apply myself to my next dream, which was to be in healthcare. And I still did not know exactly what avenue I wanted to take at that time. I ended up interviewing many different people in the field, occupational therapists, physical therapists, nurse anesthetists, nurses. My aunt was a nurse, and that was very inspiring. I actually chose nursing for a few different reasons. One was that it's one of the few degrees that you can build upon. So I knew as a naturally ambitious person, I may want to eventually go back to school or pursue something different or grow myself in the field. So I wanted to choose a career that would allow me to do that. It also was very appealing because you have much more control over your patient population that you choose to work with. And that was really important to me because I did know I wanted to work with children or the youth. When I was thinking about physical therapy, it was coming from a place of being the patient as an athlete and having multiple surgeries. I've had 5 surgeries on just one ankle. So I wanted to be a part of that healing process for maybe students or other professional athletes, and mostly young people. And it's much more difficult to select your population in those other fields outside of nursing. So with nursing, I was excited because I knew that I could choose pediatrics and I could apply myself there. And that is something that is so amazing about nursing, is that you really have that flexibility, and you can also choose. There's just so much opportunity and you're never stuck. So those are really the reasons that I dialed it down to nursing. But from a young age, I knew I wanted to be in healthcare and I knew I wanted to work with children.
That is so cool. So you ended up playing soccer and your goal was to play professionally. Is that right?
Yes.
Wow. And so you looked into other occupations like PT, OT, CRNA, and ultimately you chose nursing because you could build upon it. There's flexibility, opportunities. You're never stuck, like you said. And you said you had 5 surgeries and you wanted to be a part of that healing process. I like the way you said that. That's cool.
Thank you so much.
Mm-hmm. So what made you into the person you are today?
Oh, so many things. That's a really great question. I think first and foremost, I think family. My parents and even my grandparents were a huge part of my upbringing and instilling certain values, like hard work and never giving up, which I live by. But also my soccer experience. I think playing team sports instilled so much of who I am today in terms of being a team player, working well with others, enjoying working in teams, and being selfless. There's just so many things that happen in my day-to-day life where I can think back to a moment that a coach said something that made me that way, or an experience on the field or off the field, or working out a conflict with a teammate. supporting a teammate, being supported by a teammate, giving and receiving feedback. All of those experiences were ingrained very deeply because that was my life day in and day out. And I see it pop up in my life now every day. So I think my upbringing, my family, those values that I inherited, and my experience as an athlete are what made me who I am today.
Thank you for that. So your upbringing, your family, you said hard work. Sounds like you got some strong ethics there. And also playing soccer made you into like a team player and everything you need to be strong as a nurse. Everybody has to be a good team player to have a successful team.
Absolutely.
Yeah. So can you tell us more about being a critical float nurse?
Yes. So my job right now, actually, my title at the moment is nursing supervisor, which is fairly new for me. I started this role about 8 months ago, and it's a leadership position, which was my goal when I went back to school. I got my master's in nursing leadership, so my goal was to get more into the leadership side of healthcare and nursing. But prior to that, I was on the critical care float pool at 2 different hospitals, Children's Hospital at Stanford and Children's Hospital at Orange County. So those are the 2 hospitals that I've worked at primarily. And both of them I did critical care float pool. So I started my career at Stanford Children's Hospital in the Pediatric intensive care unit. And from there, I joined their critical care float pool when it opened. And the critical care float pool is a team of nurses that are utilized in multiple units whenever they're needed. And it's not a completely foreign concept. Many nurses float throughout the hospital, even if they're not on a float pool. But they tend to not like to do that, or they may not be that because removed from their comfort zone, and they're not as familiar with whatever unit they may be floated to. So I think that critical care or any float pool nurse has a particular personality that is extremely flexible and willing to be outside of their comfort zone. And that's what drew me to it. Is I love the challenge of learning the ins and outs of multiple units and high acuity units. I was working in the critical care, the pediatric intensive care, the cardiovascular intensive care, and at times the neonatal intensive care. So you're bouncing around every day. You could be somewhere new, or you could even be floated in the middle of your shift from one to the other. So flexibility is probably the most important attribute for a float pool nurse. But I really enjoyed it. It's an amazing experience. You get to meet so many different people. And I also liked the autonomy of sort of, you feel like a contracted worker. Like, I'm just here today. I might not belong here in my home unit, but I'm here to help. I kind of liked that you're getting to know people in all of the different units, but you don't necessarily entirely belong to one. And I also just love being helpful and helping others. So knowing that I'm placed in the unit that needs me the most that day brought a sense of satisfaction. So I'm no longer a critical care float pool nurse. I'm no longer at the bedside, but I really enjoyed all of the years that I did that work.
Yes, I can relate. I worked medical ICU and had to go to the surgical ICU sometimes, and I was a little outside my comfort zone. I remember being nervous on those days, because it's a different set of people to work with. If I needed help, I felt vulnerable. And so I had an opportunity to work on the float pool. And you're right, it's all about flexibility and also being courageous, stepping out into what you're afraid of and having that confidence that no matter what, I'm going to be okay. And you said you liked that challenge. So, but you don't do that anymore. You said you're a nursing supervisor. You've been doing that now for several months, and you have your degree in leadership. Is that right?
Yes.
Yeah. Elyse, can you tell us, how do you think society views nurses now? How have they changed you personally as a nurse?
I think right now, times have been tough in healthcare, and obviously going through a pandemic is not something anyone can imagine. Um, you try always to be as prepared as possible for disaster, and I think that's part of being in healthcare is you don't know what's going to walk in the door, but you want to be as prepared as you can for whatever it might be. And that's why we run drills, code drills, fire drills, everything you can imagine. But a pandemic is a completely unique experience. Doesn't happen often. And it's been very challenging for nurses. I think physically, emotionally, mentally, spiritually, everything. It's been such a challenge. I hear nurses talk about how hard it was when they were so fearful early on that they would not even come home from a shift to their children because they were so concerned about bringing it home. And that is just so devastating to think about. I don't have children, but I put myself in the shoes of people that experienced those fears, and it's unfathomable. And I think that has brought a new awareness to society. To answer your question, there has definitely been a lot of outreach and outpouring of support towards nurses throughout the pandemic. I think that part of that increase in acknowledgement is simply because social media has given us more ability to communicate and share knowledge and information, opinions. So we're hearing more about it. We're hearing more about nurses and nursing stories, and podcasts like this are great for getting, just the voice of nursing more public. I think that the general public and society views nurses in a very positive way. I think that the past couple of years I've seen a rise in that, and I think it's amazing. I hope that it will continue. I think that we have to take it upon ourselves as nurses and nurse leaders to share each other's ideas and support each other, lift each other up, because I wouldn't want to ever go backwards. And there's still so much progress to be made. I think that there's still a disrespect and abuse towards nurses that should not be tolerated. But in terms of the society's view on nurses, I think it's been very positive lately. And sadly, I think the pandemic instigated that. But whatever reason, I think it's a positive thing and well-deserved. And nurses have, for many, many, many years, been the most trusted profession. I believe they still are and may always be.
I agree with you. There has been an outpouring of support for nurses. Our voices have gone public, and like you said, it is positive. So what do you think are the major challenges a floating nurse faces in today's time?
Well, I don't know if it's changed dramatically, during today's time as it was before. There are many challenges to floating. It's sort of like being a travel nurse, but in one hospital. So travel nurses might be having an assignment from one state to the next. And in a hospital, we're obviously still local and in our home hospital, but bouncing around different units. So it's like a local hospital traveling team. And there are many challenges that come with that. I think for some people who really, really crave the camaraderie of a unit, it can be tough because unless you're really social and make friends in each unit that you go, you can feel a little bit isolated. I know that some float nurses have felt that way because you're always the visitor.
Right.
You don't have your own break room where you all sit together.
Mm-hmm.
Even though we work really hard as a float team to create sort of a family bond, we rarely ever work together. because you're always spread out throughout the hospital into different units. So you have to be creative. I actually have been on the spirit team for the critical care float pool, or the whole float pool, not just critical care. And it's different than how any other spirit team would operate, because we don't work together on a day-to-day basis. We don't have a break room where we can make a coffee cart or a bulletin board where we can leave each other notes. And if we did, people would have to go out of their way to go there because it's not where they are that day. So those are some of the challenges. I think in terms of the workflow, it's challenging just not having every part of the hospital memorized like the back of your hand. The supply closet can be different. Finding what you need in any given moment. You may need to rely on resources more. It's really important that you can speak up and ask for help when you need it, because you're always going to be a little bit out of your comfort zone, like we mentioned before. So people who are a bit more reserved or don't like to ask for help or embarrassed to ask for help can really struggle in a floating situation, because you have to be able to say, hey, can somebody help me? Or can somebody show me where to find this supply? So those are some of the challenges.
Yeah, I've never been like a float nurse or like a traveler nurse, but I could see where you could feel isolated, always feeling like you're the visitor. And like you said, not knowing the hospital, if you needed supplies for a patient, it may not be in the same location from one place to the next. So I could see that being challenging for sure.
Yes.
Yes. Elyse, what is the significant change that COVID-19 has brought to pediatric nursing?
Oh, I don't know if it's totally specific to pediatric, but I think it's brought so much change to nursing in general. I feel like the way we do things has changed dramatically just over the course of the pandemic. Not in how we care for patients, but more just how we have become more innovative in certain situations, how we adapt to change. And how we find different ways to do things if the previous way was not in the best interest, or for patient safety or for nurses' safety. Obviously, PPE usage has skyrocketed. We are now wearing masks 24/7. We have visitor restrictions that are not quite as strict as adults, just because many mothers need to breastfeed their baby. Children oftentimes would be severely traumatized by being left without their parent. So we do have some visitors that are allowed, but it's very strict compared to how it used to be. So that's been a huge change. And we don't have as many visitors like from sports teams or cartoon characters. Like pediatric nursing used to always bring in all of these different people, musicians, celebrities, to cheer up the kids. And we've had to really get creative on how to keep a smile on these kids' faces when they're going through some of the toughest times in their lives, because with COVID restrictions, we just can't take some of those risks.
Right.
But in terms of nursing care, I think that not too much has changed aside from, wearing more PPE than usual, and finding creative ways to do all sorts of things. So I think it's really brought a lot of innovation. I always try to look at the bright side. You may be able to, it's been a challenge. It's been very challenging for many, many people and for so many reasons, but I think it has brought a lot of positive. And anytime you're forced to pivot and adapt, I think it's very healthy and inspires growth. So there are many positive things that have come out of it.
You are exactly right. You were talking about the pandemic and the isolation. You can't have as many visitors come in. So I can only imagine how tough that must be, these kids. And like you said, you mentioned celebrities coming in, and you're having to pivot and change, be innovators, and think of other creative ways, because you can't have all these people come in. I'm on the opposite. on the opposite end of life, I work in the nursing home. So we used to have like people come in, play bluegrass music because the residents love it and sing along. And now we can't do that anymore because of the pandemic. So I can relate there. It's just in a different setting. So Elyse, what are some changes you would love to see in healthcare after the COVID-19 pandemic?
What changes would I like to see? That's such a great question. I think really just more support for nurses. I know I talked about that there has been an outpouring, but I'd really like to see more, and not just from society or from the public, but also from each other. I think that nurses really need to lift each other up. And throughout my career as a nurse, I have seen positive change in that area specifically because there's been more attention and less tolerance for nurses eat their young mentality. But it still exists, and it's not always because of an age gap. It can be for many reasons, and a lot of it is because nurses are stressed out, and they sometimes end up taking it out on each other. I don't know, exactly the reason for that, but I think there is a lot more we can do because retention is an issue right now. There's been a lot of turnover, speaking of change that's happened since the pandemic. And that is probably where I would say the greatest need is for change in the future is improving retention. And part of that, to me, is making nurses feel supported, cared for, safe, and actually enjoy going to work and not just be burdened by the stress of it. I hope that answers your question.
Yeah, I think it's interesting you mentioned the part where nurses still eat their young. It's unfortunate, but you're right, it does happen. I used to think it did have something to do with the age range or gap there, but we are burnout, we are stressed, and we are understaffed. And I do think you're right. I think stress has something to do with that, and putting it off on someone else, like barking at them, not even realizing sometimes you do it. So being part of the critical care float team can be very stressful. How do you go about identifying your own burnout, and how do you prevent and handle it?
Oh, I like that question. I am, now on a different side of things as a nursing supervisor, and part of my role actually is to manage the members of our float pool. So I find myself becoming more and more, I've always been passionate about this, but more and more passionate about supporting people and helping them through tough days, tough times. And I try to just set an example of that for people that may be looking up to me as a leader. I've always prioritized health and taking care of my body from a young age, being an athlete, getting exercise, getting sleep, which is really not always easy to do as a nurse, especially if you work night shift like I do. But I just think that self-care is so, so important. And if you recognize yourself starting to feel that burnout, it's already time. It doesn't mean maybe next month I need to take a break. You probably need it now. And I think it's just important that people feel okay acknowledging that they're feeling burnt out, and not like it's some type of weakness.
Right.
I just try to make sure people know that I'm there for them. They're supported. If they need a break, by all means, take that break. If you're not feeling well and you have to call out sick, we understand. I just think that guilt can be such a problem. It can be so devastating to your well-being and your psyche, and people feel guilt when they know people are expecting them, people are relying on them, especially people like nurses who are so empathetic, and our purpose is to care for others. I remember always feeling so much guilt if I had to call out sick because those patients need me. But the truth is, you can only give as much as you're able if your own cup is full, right? So it's so important to take care of yourself first. Take a rest when you need it. Prioritize getting sleep. It's okay to say no sometimes to social events, even though that can also be guilt-inducing for empathetic people, because you feel like, oh, I'm not a good friend if I don't go to this birthday dinner. But the most important thing you can do is rest, get sleep,
Mm-hmm.
do what makes you feel good, whether that's taking a walk on the beach, taking a bubble bath, listening to music, playing with your pets, your children, whatever it is. I just think that it's a necessity, and it should be prioritized no matter what.
Yeah, I respect everything you just said. You mentioned self-care or like your own health. You mentioned trying to get sleep, exercising, which is tough because you said you work night shift. So I'm not sure how do you sleep during the day? Do you just put up like black curtains? How do you sleep?
Yes, I have blackout shades. I like to wear an eye mask. I like sleepy time tea, melatonin. Those are all my friends.
Yes. Yes. And I also like how you said to say no to events, because if you're wore out, you're fatigued, you need that downtime before you go back to work in the next 2 days. It's totally okay to say no. And like you said, listen to music, take a bubble bath, play with your pets, play with your kids, because we're nurses. It's in us to want to help people, but we're not superhumans. Like, we have to take care of ourselves too. So thank you for mentioning that. So one more question with that. How do you identify you're on burnout? Like, how did you know you were burnout?
I have experienced burnout probably severely one time in my career. And I just felt like a need to step away from the bedside. I didn't want to let it go because I am so passionate about pediatric nursing. So what I chose to do at that time was to go just down in my commitment of time to per diem and pick up something a little bit lighter on the side. So I dabbled in aesthetic nursing. This was back when I lived in San Francisco. So I got some experience working at a med spa in San Francisco. And when I moved to Orange County, I landed a position as a nurse manager in a skincare clinic, and it was a startup. I really did not know like how valuable it would be to my career, but I learned so much. I grew quite quickly. I was at that company for 3 years, and I became the global director of medical operations.
Wow.
I was other countries, opening new clinics, managing nurses in all different states. And that was when I decided to go back to school for my master's in nursing leadership. And once I got that degree in 2019, I knew I wanted to then apply that education back to the hospital setting in a pediatric hospital. But how I recognized the burnout, I think just exhaustion, emotional exhaustion, physical exhaustion, really just constantly fatigued and not feeling very motivated, and feeling a little bit stuck. Like, where do I go from here? Because you're always grinding. And when you're grinding, and then you're working and sleeping and working and sleeping,
Right.
it's hard to step away and think about, what do I want to be when I grow up? So I sort of took that step back. I knew at that time when I was feeling that burnout that I didn't want to just work at the bedside full time for the rest of my career. As much as I loved it, I wanted to sort of explore what else I wanted to do with my career. And stepping back to per diem at that time was so great for me. And I was able to get different experience, and just another incredible example of why I chose nursing is that kind of flexibility. I went from pediatric intensive care to skincare. That's what's so amazing about nursing to me. And I recommend the career and the decision to go to nursing school to everybody that asks me, because it is just such an amazing opportunity with incredible job security and so fulfilling. But yes, back to the burnout, I think just severe exhaustion and fatigue is what helped me to recognize I needed to make a change.
Yeah, I can relate to you on the extremely fatigued. I'd sleep like 10 to 12 hours a night. I mean, literally, I'd go home, hit the pillow, and I was out. So, in this time of pandemic, do you think nurse burnout is a widespread phenomenon?
I do. I think, just because the pandemic is global, this is affecting everybody. And nurses are so great at adapting. It's one of the greatest skills nurses have, that I think 2 years into it, people might be thinking this is normal now, compared to the shock and horror that people experienced early on. The truth is it's not normal. It's still stressful. There is still fear for patients, colleagues. People are still losing loved ones. And being in healthcare, you see a lot of that. You see your friends at work lose a parent. You see a friend at work whose child has some lingering symptoms from what they hoped would be a very mild infection. There's just so much that we're still exposed to, and it's still a stressor. And I think because the pandemic is global, that is very widespread. I personally haven't spoken to nurses in other parts of the world, but I imagine they are also going through it. I know that they are. And when I speak to friends just in other states, all the way to New York, I know that they have had some very tough times.
Yes, for sure. So, what is the best message and tips you can extend to our nurses who are burnt out to keep them going?
I think my best advice is to have grace with yourself. Nurses tend to be perfectionists and can be very hard on ourselves. Expectations for ourselves can be very high, and when we don't meet those expectations or we fall short of anything, even just like a to-do list, it can feel very stressful or guilt-inducing. And I think when you're going through tough times, the most important thing to do is have grace with yourself and forgive yourself if you're feeling, off, or if you are not at your best all of the time. For all of the people in your life that are expecting from you, we can't be perfect. We can't be superheroes every day of our life. So give yourself a break and do something that brings you some joy, and try to just think of positive things. I think that everything in life, it's all about mindset. And if you think positively, it can change everything. If you're just thinking about negative things, it can drag you down, and it can drag everyone around you down. So I think just keeping a positive mindset and having love in your heart so that you can care for yourself and for others and for your patients.
You couldn't have said that any better. Thank you.
Thank you.
Is there any group or organization that you are a part of?
Yes, I am a member of the ACNL, which is the Association of California Nurse Leaders. I'm the co-chair of the communications committee for that organization. I also serve on the board for the American Red Cross in Orange County, and I'm a volunteer for their disaster health services.
Cool. You said the ACNL. What did that stand for?
Association of California Nurse Leaders.
Cool. Okay. So, what are your thoughts on the community? How do you think nurses can benefit from the NurseDeck community for nurses?
Well, I think, I touched on it earlier. It's so important for nurses to support each other and not to tear each other down, and to keep lifting each other up and amplifying the voice of nursing. I think NurseDeck does just that, in both amplifying the voice of nursing and connecting nurses and giving them a sense of community. I think that's so valuable, and I encourage every nurse to find a community of people that they can count on, share knowledge, learn from, be supported by. Sometimes, our families and friends try to be that source.
Right.
They'll never fully understand it, unless they're in it. And you also don't want to be that person that just comes home and starts venting. Even if they want to hear you vent, it's not always the healthiest decision. So I think it's great for nurses to use each other for that when we need it.
You're right. It's the place where you can go get the support, you can learn, you can talk to people who get it. So yeah. Is there a topic you would like to discuss or address that we have not already mentioned?
I don't think so. Thank you for asking.
Yes, ma'am. So are you on NurseDeck Social? It's like a Facebook.
I have just recently created an account since I was in for this interview. So I plan to explore it, and I'm grateful to you guys for inviting me and exposing me to such an amazing community that you've built, and just feeling very grateful.
Well, thank you for your time today. We really appreciate it, and we love to continue the conversation on NurseDeck Social.
Absolutely. Thank you.
Thank you so much.